My body, my rights. 𝐒𝐴𝐧𝐡, 𝐒𝐵𝐴𝐬.
𝐒𝐴𝐬, 𝐒𝐵𝐴𝐬. 𝐒𝐴𝐬, 𝐒𝐴𝐬. My body is my right.
My body, my rights. 𝐒𝐴𝐧𝐡, 𝐒𝐵𝐴𝐬.
My body, my rights. 𝐒𝐴𝐧𝐡, 𝐒𝐵𝐴𝐬.
𝐒𝐴𝐧𝐡, 𝐒𝐵𝐴𝐬. My body is my rights.
Can you tell us about your organization and its partnership with Jamnel Care?
My name is Tande Elias, and I'm the Programs Manager for Rise Initiative for Women's Rights Advocacy, abbreviated as 𝐸WA South Sudan. In my partnership with Jamnel Care, we are all in the area of sexual reproductive health, and we have run programs such as sexual reproductive health, and there's always that interlink between organizations that do the same work, and that is the reason why I'm here, as invited by Jamnel Care, as a partner, as a supporting partner in this ongoing sexual reproductive health training that they have been carrying.
What has been your role in supporting SRHR initiatives in South Sudan?
My role initiating sexual reproductive health and rights in South Sudan is basically when you look at our community, we are still constrained backward by our cultures or by some certain situations that happen in the country. And with that, people do not take time to know more about their sexual reproductive health and right. That's why we have challenges in regards to early pregnancy, poor menstrual hygiene management, contraction and spread of HIV and AIDS in our communities. And that is why it became a concern for Rise Initiative for Women's Rights Advocacy and Jamnel Care coming together to ensure that the communities are sensitized and awareness is raised so that they can get to know their sexual reproductive health and rights in the community so as to behave appropriately. Not to face the challenges that come along with poor reproductive health in the communities.
How has the collaboration with Jamnel Care impacted SRHR awareness and education in the region?
Say one hand cannot clap. And the more organizations we have on ground to carry on these trainings, the more area we are covering. Jamnel Care has played its part. And if you see specifically Jamnel Care has areas they have started with, and also 𝐸WA has areas that they have started with when it comes to sexual reproductive health. With joining Jamnel Care, we cover a lot of the demography within South Sudan or within Juba, so that we can be able to reach enough people with the training and with the necessary information that they need. So as they can protect themselves against sexually transmitted diseases or unwanted pregnancy, or engage in behaviors that will endanger them when it comes to their sexual reproductive health. So Jamnel Care joining and 𝐸WA joining and the other organization joining all in the training helps in covering enough demography in terms of the training so as it can reach further to the people at the grassroots or in different localities. And with that, you see, instead of, if it was one organization, it was going to take almost a year to finish major areas in South Sudan. But with more organizations, you might find that we take only 6 months or 4 or 5 months to cover enough larger area within South Sudan. That's how important it is for Jamnel and other organizations to come together.
Can you provide some insights into the specific contributions you made to the Munuki training sessions?
Insights we made in the Munuki training is we came to realize that some people in Munuki, they know about sexual reproductive health, but they don't know some of their rights, or they just know some layers of some of these reproductive health issues, but they don't know in depth. Like, for example, they might know HIV and AIDS in a cover. They just know that it's a killer disease and all that, but they don't know how it's contracted, how it's spread, and how to keep yourself safe from contracting HIV and AIDS. And of course, there are misconceptions on HIV and AIDS. So they have raised some of these misconceptions, and of which we're able to correct them, and we are able to give them the right information so that they can be able to benefit in the right way instead of using misconception in their daily lives. Now they have the right information, and that is an insight for me, because if we did not know that they don't know, or they did not know that they don't know, but now they know that they know. And then they can be able to go to their localities and pass the right information and have the right actions in terms of their protection, their body protections.
What were some of the key outcomes you observed from the training?
Key outcomes, number one is the welcoming and the willingness of the participants to participate and to get information. That's number one I've really seen. And number two is the way they participate. It was participatory. It's not about sitting down and just listening. People were asking questions. The methodology used was giving a room for discussion, a dialogue between the community, the trainers and the community itself. So when you look at that, it creates a room for corrections. It creates a room for adjusting some of the norms, some of the behaviors that they have in the community. So it's very, it's something that I've seen that is very, very positive out of this training. The contributions and how the methodology was used, interactive, and their willingness to be part of the training. That's why you found the 3 days consecutive. We had the first day people still coming, the second day the number is increasing, even the third day the number was even larger and bigger. That means they are willing to learn.
How do you see the partnership with Jamnel Care evolving in the future?
I see the partnership with Jamnel Care. I don't want us to only be partners. If we can come together and form a consortium of organizations dealing with sexual reproductive health, I know it might be there, but it could be not that big. But I see Jamnel Care coming in and the other organizations coming to form a consortium so that they can have a harmonized approach of sexual reproductive health. And they have already started by engaging. They were not selfish by inviting us as RIWA. Because most organizations think when they have the grants, they want to implement alone because of what? Of the money aspect of it. But Jamnel Care did not do that. What they did is they invited 2 or 3 partners to come and join them to help in the training. That's how important I see Jamnel Care. Jamnel Care's coming into this area of sexual reproductive health. They have strengthened the consortium. They have strengthened the area of sexual reproductive health, and I hope and I see still them going further with ensuring there's collaboration with more organizations, stakeholders like the Ministry of Health and South Sudan AIDS Commission and other partners that are engaged within the sexual reproductive health and trainings.
How do you measure the success and impact of such training sessions?
Measuring to measure such impact is after this training, we use specific points. That is the chiefs or the leaders of the areas to mobilize these people. So through those channels is how we are going to know, we are going to follow up. Follow-up is very important after this training. Going back to ask, what have you done with the trainings that we gave you last time? What are the changes that you have seen in the communities? And if the chiefs and the people who attended the training come and give us what they have done with the trainings they have gained, with the knowledge they have gained from here, and how the behaviors are changing in the communities, we would have measured the impact of this training in the community. But for now, we already know they have absorbed the information. That is something very, very positive for us, and we can be able to measure through that. But next up is going to be a follow-up, like our M&E, to see how they have used this knowledge in their community. And we are going to do that through the chiefs who themselves who have mobilized these community members to come. We shall find out that in the nearby future so as we can be able to measure and see the gaps, which gaps are there in place, and how we are going to design the next program so as we can cover these gaps to see that it's really impactful in the communities that we train.
𝐒𝐵𝐴𝐻𝐵, 𝐒𝐵𝐴𝐻𝐵. My body is my right.
My body, my rights. 𝐒𝐵𝐴𝐻𝐵,
𝐒𝐵𝐴𝐻𝐵, 𝐒𝐐�𝐻𝐵. My body, my rights.
𝐒𝐵𝐴𝐻𝐵, my body is my right.
My body, my rights. 𝐒𝐵𝐴𝐻𝐵.
My body, my rights. 𝐒𝐵𝐴𝐻𝐵.
My body, my rights. 𝐒𝐵𝐴𝐻𝐵, done.